I'm extremely grateful to the organizers for giving me the opportunity. I would like to give a glimpse of what healthcare of the future is going to be in the next few minutes. I believe the entire healthcare of the population of this world will be delivered through one device called the mobile phone. Doesn't matter whether you are rich or poor, this is the device through which your healthcare will be taken care of. I will give you a short glimpse of it in the next 2 minutes. We have about 500 patients in my hospital, and I take care of about 20 patients. They are my patients. And I see them, how they are doing every 2 hours in my mobile phone. I go to bed at 11 o'clock at night. Before I go to bed, I do the ICU rounds. I'm up at 4:30 in the morning, I do the ICU rounds. Before I reach the hospital, my ICU rounds are over. I know how exactly my patients are doing. Now, how this is possible? This is the world, what we call as a connected world. These are the patients of mine in my hospital. When there is a red icon, they are in the ICU, so I concentrate on them. Green icon stands for the patient in the ward. I'll pick up one patient to show you what it gives me. As I was driving on my way to the hospital, a patient who had a complex heart operation, the X-ray was done and it was projected. And I looked at the X-ray, I wanted to see some minor details by expanding it or making it smaller. And X-ray, as soon as I see the X-ray, I know that the patient X-ray is fine. Now, I just sent them a message, chest X-ray looks good. Then I can even see the radiologist report, what he thinks. And early morning, the blood test was done. I want to see the cardiac monitor, how the patient monitor, how is he looking like, I can see it. I can interact with the team. I can write my progress notes. I can communicate with the family. Whatever I can do standing next to the patient in the ICU, I can do it from my bedroom just before going to sleep. I can even prescribe medicines. Or I want to know what exactly the patient's status is. Then I have a risk scorecard. There is 20% possibility that this patient can develop a cardiac arrest within the next 24 hours. That's a low risk category for an ICU patient. So it's in a green, and that is analyzed by our analytics team, which goes to the data. So essentially, as people who may not be very familiar with the hospital, you all think that doctor has to touch the patient in the ICU. But we have a policy, you cannot touch the patient in the ICU. You will touch the patient only if you are going to do a procedure on the patient. Otherwise, you don't need to touch. You take the decision based on the data, and all these data can be seen in your own mobile phone. So essentially, this digital transformation will make healthcare safer for the patients. It eliminates the medical error. When the blood chemistry machine gets a sample of the blood and the machine processes, as soon as the report comes out, it is seen by all my 20-member team, wherever they are. A positive blood culture of an infection, if the report gets stuck up on the way and there is a delay of 2 or 3 hours before you start the right antibiotic, it can be a difference between life and death. Today, the report comes instantly. So the right action can be taken. So all this digital transformation of healthcare, which will dramatically reduce the mortality, morbidity in a hospital, will happen in India. It will happen in India because we are truly blessed to be living in a country which is filled with amazingly talented software engineers. You just tell them what your pain point is. They come up with amazing solutions in few hours. This is the beauty of living in this blessed country. Now, let me get back to my talk. I just want to start off stating that COVID has changed our world and turned it upside down. 100 years from now, when the historians are likely to write the history of the world, last 100 years, there will be two distinct periods. One is BC, that is before COVID. Other one is AC, after COVID. Because the world in which we have entered now, after the COVID, is going to be dramatically different than the world we entered. Every aspect of our life, including your personal family life, will undergo quite a major changes, and our professional life is not going to be different. Now, this transformation will have a magical impact on the global healthcare industry. It is the largest industry in the world with $8.2 trillion. But after spending $8.2 trillion, less than 20% of the world's population has access to decent health care. That is going to change. That is going to change very, very fast. Now, what is the impact on this directly in your life? First impact, in the near future, starting from headache to cancer or a heart attack, first consultation will happen online with you sitting in your drawing room and the doctors in their house or in their farmhouse or in the clinic. Every consultation will get transformed to online healthcare. Currently, the experience is not very good. It will become very good, and this is going to have a big impact because today people do not want to go to see the doctors because the experience is so bad. Why do we keep buying stuff from Amazon and Flipkart? Things we don't need it because of the joy of buying. Today, seeing a doctor is not a joy, but soon it will become a joy. In the process, every disease will get diagnosed at a very early stage. We are talking about a cure for a cancer. If cancer is diagnosed at an early stage, most cancers can be cured. It is the reluctance to see the doctor is responsible for the poor prognosis. The second change is going to be all of you are going to have your electronic medical records in your own phone. Days will be gone when 70-year-old man comes to the OPD with thick file with all the old reports. No doctor can decipher it in 5 minutes or 10 minutes they have. That is going to change. The patient is going to come to the OPD and he will ask the doctor's secretary to decipher the QR code, and the entire medical history will be in the doctor's laptop or a tablet. The experience will change. Why the experience will change? Today you see any doctor, first thing he will ask you is, what is your family history? What is the previous history? What is the operation? It is a frustrating experience for a patient in a hospital to narrate the same story to every doctor he sees after a few hours. Now it will all be seen. Your past history is not going to change. Once you have narrated, that is all it is. They are going to have it in the record. The second change is, before you see the doctor in a hospital, his nurse will call you 2 or 3 days earlier. They will take your history, they will enter the entire history. Now, when you are going to sit in front of the doctor you are not going to tell the story to the doctor. Doctor is going to tell your story, that 5 years ago you had your first heart attack, 3 years ago you had an angioplasty, you were fine for 2 years, then again you started developing chest pain, and at the end of 3 minutes, patient is so impressed that I am seeing a doctor who knows everything about me. And this is the experience which you are going to have. The next big thing what is going to happen is that whether doctor is going to like it or not, every doctor will be forced to use the EMR. And smart software is going to make smarter diagnosis than doctors. This is the reality. And within 5 to 7 years, every country will mandate their doctors to get the second opinion from the software before starting the treatment. This is the reality. Now, we may think that how can these things be mandated to the doctors? It is going to happen. It has happened in your own country. 5 years ago, Chief Justice of Uttarakhand passed a regulation, law in Uttarakhand, that no doctor can prescribe medicines on a paper. They have to do it on a digital format. Unfortunately, it couldn't be implemented because digital tools were not there, but it is going to come. It is a matter of time. Why I strongly feel that mobile phone is a tool in which all this will happen, because a patient's condition in the hospital changes every few minutes, and doctors should know about it instantly. Now, if they need to see the patient's condition online and real time, there is only one tool. Today, all the billion-dollar EMRs of United States are built for the desktop. They are not built for the mobile phone. But unfortunately, doctors in India or in US look at the desktop only 5 to 6 times in a day. But they look at their mobile phone 200 times in a day. So if you really want them to see your information, it has to be on a mobile phone. When you go to the reception of a hospital, there will be reception without receptionist. Because whatever you are doing today in a reception, where you give the name, address, everything is entered and you make the payment, everything will be done online by the receptionist staying at home and patients in their house. In the hospital, eventually, there will be only people who are going to work who are going to be touching the patients. Everyone else who need not touch the patient will not be in the hospital. They'll be working from home. When you enter the intensive care unit, there will be intensive care unit without the intensivist. Where will be the intensivist? They will be at home. There will be few junior intensivists in the ICU who are instructed what to do by the senior intensivist who are managing the patients from home looking at the data. Because ICU in India, US, Europe gets the best care only between 9 to 5 when the senior doctors are present. 16 hours in a day, ICU in India or Europe, anywhere in the world, patients get suboptimal care by junior doctors and junior nurses. This is the reality. That will change if we split the 16 hours into 4-hour slots, and doctor sitting in his drawing room has the cardiac monitor with patient's data coming, all the blood reports coming, and there is a video call in which he can see the patient. Sitting at home, they can see the color of the urine to find out whether there is any hemoglobin in the urine. He can interact with the patient. He can interact with the doctor. By doing it, what is the difference? Can you possibly expect a doctor who was on duty from 6 o'clock or 7 o'clock in the evening, at 4 o'clock in the morning, he hasn't slept, he's going around and doing the rounds? Is he in a mental status to take the right decision based on hundreds of data coming in? He cannot be. Human beings are not made to work like that. But a doctor sitting at home who got up at 4 o'clock in the morning after a sound sleep, has a cup of tea in his hand, he has all the data coming. He is the person who can take the right decision. And this will dramatically change the way the ICUs are run. COVID has shown that in the hospital, only the people who are working should be working, who are touching the patient. Those who are not touching the patient shouldn't be there. We have hundreds of girls and boys working in the hospital whose only job is taking one blood sample from one bed to the lab, bringing the blood sample from the lab to the bedside, and they are not adding directly to the patient care. They are not doing any critical work. And by having hundreds of these people coming to a hospital where there is a deadly infection, they may get the infection, or they may be the carriers of the infection. So all these jobs will be replaced by inexpensive robots which will run around the hospital carrying stuff. Today robots are expensive, but it is not going to remain expensive. Once all these jobs are done by the robot, cost of robot will also come down. Every patient suffering from chronic disease like diabetes, hypertension, the kidney failure, heart failure, they will be managed online. We have over 10,000 patients whose diabetes is managed online. And our diabetologists have proven that the patients who prefer to see doctors online, their blood sugar is controlled better than the patient who insists on seeing doctors in the clinic. Because blood sugar goes up and down, and every time it goes up and down, they cannot see the doctor whenever they want. One full day of work is gone, whereas now, the moment the blood sugar goes up and down, in WhatsApp they take a photograph and it reaches the doctors, nurses. In no time they get the reply. So in the future, management of diabetes will be dramatically different. Then there is going to be a major change in the patients, how they are looking at their own health. Today, when I see a 65-year-old man having had a major heart attack, heart is completely damaged, I ask them, didn't you go for a checkup or didn't you see a doctor 1 year ago? And the man with the proud, he'll say, thumping his chest, doctor, I never saw a doctor. As if it is a great achievement. He is in the mess because of that. If he saw the doctor 6 months earlier, he wouldn't have been in this mess. The moral of the story is, you should see your doctors when you don't need to see them. You need to do the test when there is no need for those tests. Then you will not see the doctor when you land in trouble. And even if you are going to have a trouble, it can be anticipated, it can be prevented, or if it happens, it can be treated at the right time with the best outcome. And all this will happen if we change the experience of healthcare. And that is going to happen. So the concept of health insurance will undergo dramatic change. Today, health insurance is an industry which is extremely complicated, with every 3 parties involved, with the big problem of the trust deficit. There are 3 parties in health insurance. One is the patient. Patient doesn't have a great confidence with the insurance company because they are worried whether they will pay when I need it. And patients do not have a great confidence with the hospital because they are worried if I am insured, they are going to charge me more. Now there is an insurance company. Insurance company doesn't trust the patient because they hide the information. And insurance company do not have a great faith in the hospital because the moment they are insured, the premium will be different. And then there is hospital. And the hospital doesn't trust both these parties. So we have 3 groups which do not trust with each other. How will you run the business? But this will get disrupted. This will get disrupted with the data and low-cost, affordable health insurances coming in the form of app-based health insurance schemes. These insurances will become a financial intermediary. Today, when you see their advertisement that 999 rupees, 1 lakh rupees of premium, the payment will make, doesn't matter, pre-existing condition, they make all kinds of tall promises. And smart people like us think that these are going to lose their shirt. It is not going to happen. It is going to happen. They are going to introduce the beauty of health insurance. No civilized world pays from their bank balance for the health care. They all have a health insurance. Today, unfortunately, the insurance schemes are not affordable and they don't keep up to the promise, but things are going to change. So, in the end, I would like to end my talk stating that the Uber, which is the world's largest transport company, doesn't own any taxis. Facebook doesn't create contents. Alibaba, world's largest retailer, has no inventory. And the Airbnb, which gives the largest number of hotel rooms, doesn't own hotels. And the largest healthcare provider in the world will not have a bed. It is going to be a software. And I believe that software will be developed in our country. And I have no doubt that in the near future, India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. We are truly privileged to be living in a country called India. Thank you so much.
Thank you so very much, Mr. Shetty. Now, ladies and gentlemen, I would like to invite CEO of TPML and editor of Deccan Herald, Mr. Sitaraman Shankar, to hand over a token of our appreciation, a memento being handed over. Thank you so very much for that wonderful keynote, Dr. Devi Prasad Shetty. A huge round of applause for them, ladies and gentlemen. Thank you.
Thank you. Thank you. Thank you.